Hey, welcome to MediByte. We're all about breaking down complex health topics and making them super simple. And today, we're going to tackle an illness that almost everyone has heard of, but maybe doesn't fully understand: chickenpox.
All right, so here's what we've got on tap. We're going to look at what chickenpox is exactly. Then we'll get into that classic rash, you know the one. We'll also talk about the real risks and complications, its kind of surprising connection to another illness, and most importantly, how we can actually prevent it.
Okay, first things first. To really get what chickenpox is all about, we have to know what's causing all the trouble. Let's meet the culprit.
So what are we actually dealing with here? Well, the fancy name for it is the Varicella-Zoster Virus. This thing is a type of herpes virus, and believe me, it is super contagious. It spreads through the air when someone coughs or sneezes, those little airborne droplets, or you can get it just by coming into direct contact with the rash itself. And if you want to get a sense of just how good this virus is at spreading, check out this number: 4 million. Before we had a routine vaccine, about 4 million people in the US got chickenpox every single year. Wow. That's like the entire city of Los Angeles getting sick year after year. It was just everywhere.
And here's the really tricky part, the thing that makes it so hard to stop. A person with chickenpox is actually contagious for up to 2 days before they even see a single spot. Just think about that. You could be spreading the virus all over the place and have absolutely no idea you're even sick yet.
All right, so let's say the virus is in and those first spots start to pop up. What happens next? Let's talk about the most famous part of this whole illness, that telltale rash. Yeah, the whole thing follows a pretty predictable path. It usually kicks off with you just feeling kind of crummy, maybe a headache, a bit of a fever, just off. And then the rash shows up and it goes through these different stages. It starts as little red spots, turns into those super itchy, fluid-filled blisters, and then finally they all dry out and scab over. And this right here, this is a huge clue for doctors. The rash doesn't just show up all at once. It comes in these waves, or what doctors call crops. So you'll often see everything happening at the same time on one patch of skin. Brand new spots, a few blisters, and some old scabs. It's a real hallmark of chickenpox. A lot of us think of chickenpox as just some harmless, itchy thing you get as a kid. A rite of passage, right? But we really need to talk about the other side of it, because it can have some pretty serious complications. It's not always just an itch. And for some people, chickenpox is a much bigger deal. We're talking about newborns, for instance, and adults who actually tend to get way sicker from it than kids do. And, of course, anyone with a weakened immune system or people who are pregnant. For these groups, it can be really dangerous.
And those complications, they're the whole reason we take this virus so seriously, even if they're not super common in healthy kids. All that scratching can lead to nasty bacterial skin infections. And in really bad cases, the virus can actually cause pneumonia, a serious lung infection, or even encephalitis, which is a dangerous swelling of the brain.
Okay, this next part is a super important warning, especially for parents. If you have a child or a teen who has a fever and you think it might be chickenpox, you absolutely must not give them aspirin. There's a link between aspirin and a rare but really severe condition called Reyes syndrome, which can cause major damage to the liver and brain. So no aspirin, period.
Okay, now we get to a really fascinating part of the story. Because, you see, when you get over chickenpox, the virus doesn't actually go away. It sticks around for a second act. So, where does it go? It's a great question, and the answer is the key to understanding a whole different illness that can pop up, sometimes decades down the road.
So, after the rash is gone and you feel better, the virus basically goes into hiding. It travels to these nerve cells near your spine and brain and just goes to sleep. It becomes dormant. It's inactive, but it's still there, just waiting. And then years, sometimes decades later, something can trigger that sleeping virus to wake up. But when it comes back, it's not chickenpox anymore. This time, it's something called shingles, and it's totally different. Instead of an all-over itchy rash, you get this really painful, blistering rash, usually in a stripe on just one side of your body. Okay, so let's recap. We have this super contagious virus. It can cause some nasty complications, and then it literally hides in your body for the rest of your life, which naturally leads to the most important question of all. How do we stop this whole thing from even starting? Well, the answer is actually pretty straightforward. The absolute best way to prevent chickenpox, and all the stuff that comes with it, is the varicella vaccine.
It's a safe, incredibly effective 2-dose shot that's a standard part of childhood immunizations. It just works.
And hey, this isn't just for kids. If you're an adult and you somehow dodged getting chickenpox as a kid and you never got the vaccine, it's still a really good idea to get it, especially since, as we've talked about, the illness can be a lot rougher on adults.
So after all that, what's the big takeaway here? What's the one thing you should really remember?
Look, if there's one thing to take away from all this, it's that chickenpox is not just a simple childhood rite of passage. It's a seriously contagious virus. It can cause major complications, and it stays in your body forever with the potential to come back as shingles. But, and this is the important part, we have a safe and powerful way to prevent it all: vaccination. It's a real game changer. All right, that's it for this explainer. We really hope this helps clear things up about chickenpox. If you found this useful, please do us a favor. Hit that like button, share it with someone you know, and subscribe to the MediByte channel for more simple, clear health content. Thanks so much for watching.